Welcome to the training day. Medical assistant transition training from primary care to specialty gastroenterology clinic. In this opening session, our job is to get oriented, set expectations, and explain why GI clinic work feels different from general primary care work. We are also going to establish the main safety frame for the day and do a short pre assessment so we know where everyone is starting. Let's begin with the big picture. If you have worked in primary care, you already know how important medical assistants are. You room patients, gather information, help visits move efficiently, support communication, and often notice things other people miss. In GI clinic, those same strengths still matter, but the details become more specialized. Patients often come in with symptoms that are sensitive, hard to describe, or easy to minimize. They may be dealing with bleeding, trouble swallowing, chronic diarrhea, severe constipation, weight loss, nausea, colonoscopy prep instructions, medication confusion, or anxiety about an upcoming procedure. That means the GIMA role depends heavily on accurate symptom history, clear patient instructions, and careful workflow support. That sentence is worth repeating because it is the core message of the entire day. GI clinic depends on accurate symptom history, clear patient instructions, and careful workflow support. If those three things are done well, patients are safer and the clinic works better. If those three things break down, important symptoms can be missed, procedures can fail, and follow up can become unsafe or chaotic. So, what is different about GI clinic compared with primary care? In primary care, you may room a patient with a sore throat, high blood pressure, diabetes follow up, or joint pain. In GI clinic, the visit often depends on more detailed symptom pattern recognition. Instead of simply writing abdominal pain or constipation, you may need to help gather information about timing, stool frequency, stool consistency, bleeding, nausea, vomiting, food triggers, weight loss, prior GI procedures, over the counter medicines, and whether the patient followed prep or fasting instructions. In other words, GI clinic is often more detail sensitive. The other major difference is that GI clinic frequently connects office visits with procedures, pathology, and follow up coordination. That means you are not just helping with a clinic encounter, you may also be supporting bowel prep teaching, medication review before sedation, escort confirmation, specimen handling, discharge reinforcement, and result follow up. A missed detail in any of those steps can create real downstream problems. Let's talk briefly about the GI team. Depending on the clinic, you may work with a gastroenterologist, an advanced practice provider, an RN, one or more medical assistants, schedulers, endoscopy staff, and pathology or lab partners. Each role matters. The gastroenterologist or APP evaluates and manages the clinical problem. The RN may handle clinical triage, procedure nursing work, or patient education tasks depending on the setting. The MA often becomes the person who helps organize the practical flow, gathering information, preparing the visit, reinforcing routine instructions, documenting clearly, coordinating next steps, and speaking up when something seems urgent or inconsistent. That last piece matters a lot. Speaking up is part of safe practice. If a patient reports black stool, heavy bleeding, trouble swallowing with weight loss, severe dehydration, fever with abdominal pain, or sudden jaundice, that is not just another checkbox item. That is information that may need urgent escalation. Throughout today, we are going to keep separating routine workflow from high risk concerns that should move quickly to a nurse or provider. Before we move on, I want to acknowledge something practical. GI symptoms can be embarrassing. Patients may hesitate to describe stool, rectal bleeding, bloating, reflux, nausea, or bowel accidents. Some will give vague answers because they feel uncomfortable. Part of your job is to make the conversation feel safe and matter of fact. If you are calm, respectful, and non judgmental, patients are more likely to tell you what is actually going on. In a few minutes, we will do a short pre test. This is not about catching anyone off guard or proving who already knows the most. It is simply a way to understand the starting point for the group and to help highlight the topics we most need to reinforce today. As you take it, do not worry if you are unsure on some questions. That is exactly why we are here. As we close this opening session, here's the main takeaway. You are not here just to learn GI facts. You are here to learn how those facts connect to the MA role, how to ask better questions, give clearer instructions, support safer procedures, notice red flags, and help the clinic function well. In the next session, we will build the foundation for that work by covering basic GI anatomy and physiology in a way that is practical and easy to use.